Hello, and welcome to your OBGYN rotation. My name is Philip.
And my name is Beryl. These videos will provide a brief overview for your obstetrics and gynecology rotation at Brigham and Women's Hospital.
The general gynecology service rounds every morning at 7 a.m. here in the Swift Library. When you come into the room, feel free to have a seat at the table. Rounds usually begin by discussing any of the consults that came in through the emergency department overnight. We'll then talk about any of the inpatients currently admitted to the service. And finally, we'll review the OR schedule for the day. You will have received your OR schedule the weekend before you start on service. This will give you plenty of time to review the surgeries that you'll be involved in, as well as details about the patient's history and indications for the procedure. The ORs typically start at 7:30 in the morning. This means you'll usually leave rounds around 7:15 a.m. with the resident that's assigned to the case in order to pre-op the patient. Sometimes you might leave in the middle of rounds, and this is perfectly acceptable. On the benign gynecology service, your day will typically end here in the Abramson Library around 5:30 p.m. when everybody comes in to sign out their patients to the night resident. If you happen to be covering a night, this is the room where you'll meet up with the night resident to get sign out from all of the covering day teams. The GYN oncology service rounds every morning between 6 and 7 a.m. here on CWN 8 North. You should touch base with the intern the night before each day to find out what time rounds will be, as well as what surgical cases you'll be assigned to, so that you have time to adequately prepare for the case. Your first day on the oncology service, you should just follow along during rounds. You're not expected to present any patients on that day. However, on subsequent days, you should talk to the intern about finding 1 or 2 patients that would be appropriate for you to follow and present on rounds. Eye protection as well as masks can be found above all of the scrub sinks. Head covers can be found either in the pre-op area or at the entry to all of the operating rooms. When you're ready to scrub, you'll typically have goggles and an eye mask on, but I'm going to leave that off for the video so you can understand what I'm saying. The first thing you'll do is grab your scrub. Most people use the chlorhexidine scrub, but any of the ones available are acceptable. Next, you'll squeeze it between your hands to get it nice and soapy. And open it up. There'll be a hands-free trash can available to dispose of the trash. Next, you'll wet both arms, always keeping your hands above your elbows. The first thing you'll do is use the nail pick to clean under each of your nails. Next, you'll use the nail scrub to brush the tips of all of your fingers. Next, you're going to brush all of the surfaces of your fingers, hands, and arms. Each surface that you brush should receive 10 total strokes. So that'll look something like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You'll do this starting with your fingers and then your palms on each hand, and then working down to your arms and elbows on each hand in a sequential fashion. Lastly, you want to rinse your hands going from your fingertips all the way down towards your elbows. If you need to run your hand through again, just run it back, fingertips down to elbow. Shake your hands off and then head into the operating room. When you first walk into the operating room, you'll want to write your name down on the board. Next, if it's appropriate, go ahead and introduce yourself to the circulating nurse as well as the scrub tech. Then you'll ask a scrub tech whether there's a gown and your glove size available. If not, you can grab those items and help to open those for the team. Lastly, you'll go ahead and help get the patient in the correct position and ready for surgery. Thanks for watching. We really hope you enjoy your time with us.
And if any questions come up during your rotation, please feel free to reach out to your resident mentor or to talk to any residents on your service.
Good luck.
Good luck.